Mostly as a doctors in Somaliland, we don't discuss anything about the STI. The people who are living here, they don't like to hear the word of sexual because, it is haram or prohibited.
There is a lot of patients those have a sexual transmitted disease in our country, in Somaliland, but it's not easy to identify.
It's something that we usually don't ask in our culture.
So it's a big challenge to find a way. How do you ask this question and how do you explain to them about this disease?
My name is Sena, and I am a doctor at Hargeisa Group Hospital. When I was young, always I was thinking that being a doctor is the most important job that kind of person get, because always you are going to help someone.
I met Zainab in 2014 when I travelled to Hargeisa to deliver the King's Leadership and Professionalism course. I instantly connected with her, having chosen a project in sexual health, which really is quite closely tied to obs and gynae. I knew that we were going to form this relationship and it was going to be the start of something that we would carry on into the future.
I was one of the lucky doctors who get this chance. So in order to complete the course, you need to do an audit.
Zainab in her audit highlighted that the vast majority of junior doctors wouldn't take a sexual health history and examination in patients that were at high risk of sexual transmitted infections, which I thought was astounding.
There's a lot of patients in HIV where I work who didn't come for medicine because of stigma, and they end up either having infertility or sometimes they have been admitted to the hospital with a permanent disability, having sinus infection, and they have a permanent weakness. And most of them, they die. Everybody is a risk to get sexual transmitted disease. Any person can be infected from any time in their life.
After learning about the results that Zainab highlighted to us, I knew that the partnership had to do something about it. So one of the ways in which we wanted to combat this and to open up the discussion to make it easier to talk about sexual health was by having this online course. Medicine Africa is an online classroom which is text-based, which brings together health workers in Somaliland as well as health workers that are volunteering in the UK. In drawing up the course content, I had to work closely with Zainab to make sure that we were tailor-making a course that was appropriate for Somaliland. She is a junior doctor on the ground. She knows what's going on there. She knows what the problems are that the junior doctors face.
What are sexual transmitted diseases? How you are going to take a good history from a patient you think she or he may have a STD disease. How you can go for examination, and finally how you can arise or increase awareness in community.
The course helped me because it's online. I can access it from any place because in night time it's difficult for women to go outside the home.
There's no judgment, anyone can type whatever they want. It's easier to ask questions about difficult topics, and I think that's what makes it really important, that we've managed to find a way of teaching a difficult subject really easy.
This partnership is very important and can make a lot of changes and improvement in Somaliland.
We actually hope that in the future it's the local Somaliland doctors that take the lead on this, independent of our involvement, and don't essentially require us, which would be the future goal.
Being a doctor is a matter of serving to the public people, because that's why you are a doctor. You don't become a doctor for yourself, you become a doctor for your community.
These junior doctors are the future of the Somaliland healthcare system. Working together with them on this project has been such a privilege.
I'm really hopeful to the future, but there's still a long way to go.